March is National Sleep Awareness Month. It's a great time to learn about the benefits of sleep and how that can impact your overall well-being. Chief of Nuclear Medicine at the University of Maryland, Dr. Vasgen Dilsasin is going to join us now to talk more about it. I appreciate you being back with us. A lot of people might have lost sleep after watching what was happening yesterday, and you know, I say that in a serious way because it always seems like there's something, right, that's keeping us from getting a good night's sleep. Now, you're on the cardio side of things, right? And with nuclear medicine, what are you looking at now as a link between that sleep and our health, particularly our heart health?
Yeah, it's a great question, Steve. As you know, the most common cause of referring for nuclear medicine studies is chest pain, shortness of breath. What's nuclear medicine stress test? We inject, everybody knows you place a patient on a treadmill, you run. In this case, we inject a small amount of radioactive drug in the vein to measure blood flow in absolute terms. And the most common cause of shortness of breath is reduction in blood flow through the coronary arteries that are plaqued. An alternate explanation of the shortness of breath is the obstructive sleep apnea, which is that at nighttime, a lot of patients have these repetitive episodes of obstruction of the upper airway of the muscle. The muscle gets weaker, the tone, as you age. And what happens is the tongue falls back and obstructs the airway. And we're familiar with people having snoring at nights, but then sometimes people wake up gasping for air or choking. And in the morning, they don't feel as well. They even wake up with a headache in the morning. And during the day, they may even have loss of memory, difficulty remembering things. So it's a serious problem.
And we've talked about sleep apnea in the past, and for those who have it and those who deal with it, and we've talked about ways that you can manage it. Do a lot of folks not even realize that they have this? Is that part of the test that you're doing now?
Yeah, so a lot of patients think that snoring is normal. The problem is gasping for air or choking is not normal. And so, and the way we find this is that it's underdiagnosed and undertreated. It's because a lot of time patients don't even express their symptoms to the physician. So when patients are referred to me to detect plaqued coronary arteries, oftentimes the issue isn't the reduction in blood flow in the plaque. It's related to the lungs. And what happens is that when you obstruct your airway, you have decreased oxygen supply. That oxygen supply will cause the small arteries in the lung to constrict. And when the right side of the heart is trying to pump, it has a lot of pressure against the lung. So with time, it dilates, it fails, you get short of breath, you get swelling of the legs. And then that's the time when the patients present to the physicians, where it's pretty late in the phase of the disease.
I mean, it's interesting because you're right. You might think it's one thing, but it could be something completely different when it comes to the correlation between the arteries and the lungs. Is that the sleep part of it? The disruption of sleep, is there any other part of the sleep cycle that can impact your coronary health as well, or is it just when it comes to the sleep apnea?
Well, it's interesting. It's a good question. Well, if you don't have good night's sleep and you're stressed during the day, stress itself, if you have underlying plaques in the arteries, can worsen your symptoms of chest pain, shortness of breath. So we talked about this in the past, that we have to minimize our anxiety, especially post-COVID, to have more socialization and have better sleep nights besides the obstructive sleep apnea.
I mean, it really, it seems like the most simple doctor's advice, right? To try to ease the anxiety and get a good night's sleep. But you're right. I mean, it really, in a concrete way, can help the physical health.
Yes, it does. And so again, I think that the key for here is that if you do have the symptoms, do see a sleep specialist, sleep apnea specialist. Very simple. You can have a sleep test even at home. You don't even have to be in the hospital. And the obviously treatment options are growing now. There's artificial intelligence, there's machine learning, personalized approach of treating this. So we're all worried about the CPAP, but there's much more advanced technologies that are being developed now.
Well, I mean, it's great to talk about, especially with so many folks and so many viewers we have who are dealing with the sleep apnea to begin with. There's the information if you'd like to find out more about nuclear medicine. And Doctor, I appreciate you being with us once again to share your own expertise and knowledge with us this morning.
Thank you
so very much.
It's a pleasure to be here, Steve. Thank you.